too expensive, and too impractical?
Well, I think the first thing to say is that probably all Americans share the goal of opening schools safely as soon as they can be. So I don't think that's even a matter of debate.
I hope they
in the
can
country.
open them
I do
safely.
think that there are going to be many challenges to opening schools safely, and just kind of asserting that schools now must open safely doesn't make it so. It's going to be pretty difficult for many schools. States around the country have been preparing for this, so it's not like nothing has been going on to that effect. But there are still some uncertainties about transmission in schools. As you said earlier, it's true that many schools have been opened successfully in different parts of the world, but in those places, most of those places, there was much less transmission than is going on now. So I think we should move ahead with plans to... Sure.
Well, let me just ask you, because there have been outbreaks in some summer camps around the country this summer. Let me go back to the question that I asked Secretary DeVos.
Really?
Where's the science here? What do we know about the risk of kids getting the illness, and what do we know about the risk of kids spreading the illness?
So we do know that kids are at much lower risk of serious infection than adults.
They're much lower risk than adults. Great.
Of children, including tragically a death yesterday in South Carolina of a 5-year-old. So there are serious outcomes in children.
Sad that
far
a
less
5-year-old died in
What's
South
less
Carolina.
clear is how efficiently kids will spread the virus in school, both to each other and to teachers, adults, and parents.
We need to be concerned about the teachers.
It seems like that has been relatively uncommon, but there are examples such as in Israel in the last couple of months. There was a large outbreak in schools when they reopened. And so I think there still is uncertainty that we're going to have to live with. We probably won't know all the answers when we start in the fall, but we'll have to watch very carefully and react to what we find.
What do you think of the President and Secretary DeVos's threat to cut school funding for school systems that don't reopen fully?
Yeah, no, I think issuing an ultimatum for schools opening is the wrong approach. I think guiding schools and helping schools with financial support and encouraging schools to follow CDC guidance and state health department guidance is the right way to go. I think our incentives are all aligned in the sense that everyone really does want schools to open safely, but mandating it under a very tight timeline, such as what happened in Florida this week, where they're required to open schools.
Oh my goodness, I'm glad I don't live in Florida.
Before the state has really even had a chance to review schools' plans, seems really like the wrong approach to me.
Let's step back from schools and look at this whole resurgence of the virus in new parts of the country, especially along the Sun Belt. I want to put up a graph of the wave of cases. At the height of the pandemic this spring, we recorded, this is at the height, 36,000 new cases.
36,000
on Friday. We saw
new cases.
68,000
new cases.
And I want you to take a look at this chart, and the yellow line, you can see that as we were all ourselves on the back,
all the way up there,
of new cases in mid-April, and after going down from the peak, the new case increase started to plateau. But since mid-June, so really for a month now, we have seen...
Well, because people are going inside because it's too hot to go outside.
Doctor, how serious is this surge in new cases, and how do you explain it?
It's really serious. I think the country is not in a good place with respect to COVID right now. I think of course, there are places in the country where there are states doing well, but as you said, across the South and in California and in a variety of other states, we're having sharp increases in cases, sharp increases in hospitalizations and ventilator use, and now increases in deaths. So
very sad to hear that.
A number of explanations, and that probably depends on the particular location, but in general, I think we don't have unity of message. We've been getting conflicting messages about mask use at the White House level and from state governors. We've had insufficient attention to indoor large gatherings, and too many people are meeting for social gatherings in large numbers. We got to get back to the basics. Wearing face coverings, 6 feet apart, telecommuting, avoiding large gatherings, and really having a strong central message. And in places where they're having serious hotspots, I think we should be giving consideration to stepping back from reopening, moving back a phase. It doesn't need to look exactly like it looked in March or April. I think we should still try and have people going to work. But this idea that we can normalize large social gatherings again, that's just not right. And we're going to have to change course, or we're going to continue to see these rises.
Let me talk about another aspect of this surge, and that is what's happening with not new cases, but deaths. And I want to put up the same chart, but with a focus on a different line. Again, look at the yellow line here. That's not the new cases, that's the number of deaths. You can see that spiked in mid-April, has come down sharply, although there has been an increase in deaths in the last week, more than 800 the last few days. How much comfort should we take, Doctor, in the decrease in deaths against this huge increase in cases?
I don't think we should take any comfort in that number. It's wonderful that the number of deaths went down to in the 200s for a time, but we're now back to 800 to 900 deaths a day in the United States. If you compare that to the numbers in Europe, for example, Germany had 6 deaths yesterday. France had deaths in the teens in the last couple of days. And there are parts of the world where there are no deaths. Vietnam has had no deaths from coronavirus.
That is good
Thailand
news.
has had no deaths in 6 weeks. New Zealand has had very, very little mortality from this. So it is not, we should not accept as normal the 800 or 900 deaths that we have in this country. We can do better. We can actually make this disease much, much less serious in this country.
Finally, President Trump wore a mask in public for the first time yesterday during a visit to Walter Reed Medical Center. You talked earlier about the mixed messages coming from Washington, the White House, various levels of government. Do you think it would have made a difference if President Trump and Vice President Pence had started wearing masks months ago? And what do you think of this debate, the argument that wearing a mask is a matter of personal freedom?
I do think it would have been better to have started wearing masks, demonstrating wearing masks at the highest levels of government a long time ago when CDC came out with their original guidance. But at this point, I think the most important thing is to look forward and to think about what will make the most difference. And I think that having the president, the vice president, and governors wearing masks when they're out in public is the right thing to do. I don't think we should think about this as a personal choice. We don't think it's a personal choice to drive through a neighborhood at 80 miles per hour. We agreed to slow down because we want to protect kids. The same thing is true here. We want to wear masks to protect our neighbors.
Dr. Inglesby, thank you. Thanks once again for joining us. Always good to talk with you. Up next, President Trump commutes Roger Stone's prison sentence, drawing blowback from Democrats and even a few Republicans. We'll bring in our Sunday group to discuss that, plus the Supreme Court ruling on whether investigators can see the president's tax records.